Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. This cardiology seminar is brought to you by Triple N Media on our YouTube channel. We have more than 200 cardiology lectures. We welcome you to watch them. We also kindly request you to subscribe to our YouTube channel so we can keep you abreast of our latest additions to the cardiology lectures. I have created a cardiology rotations manual for medical students, nurses, residents, and fellows. I'll tell you how you can get a free copy of this 175 pages of pertinent information to make your cardiology rotations much more meaningful. The feature presentation is a diastolic murmurs, early, mid, and late, and some of the misconceptions regarding the timing of the diastolic murmurs. Let us begin with the feature presentation. Basically, the diastolic murmurs are the ones which happen during the diastolic phase of the cardiac cycle. They could be in the early part of the diastole, or it could be in the mid part of the diastole, or it could occur during the later part of the diastole or before the systole begins. However, we will find out things are not as clear-cut as it is shown here in this picture. In order to understand the origin of these heart murmurs and the timing and duration, we need to understand the cardiac cycle. Pressure differences between chambers during the cardiac cycle. As we can see, here we have the closure of the atrioventricular valve resulting in the beginning of ventricular systole. Here we have the isometric volumic contraction followed by opening of the aortic valve, which causes the flow of blood into the aorta, and then we have the closure of the aortic valve. Then we have the isovolumic ventricular relaxation followed by a decrease in left ventricular pressure below that of the atria, which results in flow of blood from the atria into the ventricles, and this is the diastolic phase, and this is the systolic phase. The diastolic phase is divided into rapid inflow period, diastasis, where the flow is sort of constant, and atrial systole, during which the blood is pumped through the atrial contraction. The diastolic murmurs can be happening during the early part of the diastole, or it could be during the mid part of diastole, or in the pre-systolic period, which is during the atrial contraction. And your third heart sound happens during the rapid inflow period. So let us look at how we get early, mid, or late diastolic murmurs and what causes these murmurs. Predominantly, there are three situations where we can expect to hear a diastolic murmur. It could be at the aortic valve level if we have an aortic regurgitation. Because of the pressure difference between the aorta and the ventricle, we can hear a murmur because of the leak. You can also hear diastolic murmur due to mitral or tricuspid valve stenosis. Because of increased pressure in the atria compared to the left ventricular and diastolic pressure, we are going to hear a diastolic murmur, and I'm going to expand on that in a minute. The third situation where we can hear diastolic murmur would be in a patient with patent ductus arteriosus, where we get a continuous to and fro murmur like. Let's focus on mitral stenosis. Mitral stenosis murmur is caused by the pressure gradient between the left atrium and the left ventricular and diastolic pressure. As the left ventricular pressure begins to drop below that of the left atrium, we have the rapid filling of the ventricle. It is during this time we get the opening snap, and as long as there is pressure gradient, we are going to hear a murmur because of the stenotic valve restricting the flow. There are several things that account for a heart murmur. One is the pressure difference between the chambers. Number two is restriction of the flow to the blood between the chambers. And number three is the contractility of the atria or the ventricles. because as you can see in patients with the mitral stenosis with atrial fibrillation, we may not see the presystolic accentuation. Here we can see in this diagram where the murmurs are sort of demonstrated along with the cardiac cycle. Here we have the second heart sound followed by an opening snap in the early rapid filling phase, followed by a diastolic murmur. Even though it is said mid-diastolic murmur is characteristic of mitral stenosis, in fact, the mitral murmur begins with the opening snap. Here we have a crescendo, decrescendo, and the decrescendo part continues throughout most of the diastole because of the stenotic valve, creating a restriction of flow from the atria into the ventricle. Keep that in mind. Similarly, with aortic regurgitation, we have the same, but the aortic regurgitation begins with the closure of the aortic valve. When the aortic valve closes, because there is a leak in the aortic valve, there is blood flowing back into the ventricle, and as long as the ventricular pressure is lower than the aortic pressure, there is going to be blood flow. But in patients with severe aortic regurgitation, because of the elevated end diastolic pressure, the pressure difference may be small. That's why we get a very high pulse volume, which is known as the water hammer pulse, where the diastolic blood pressure when you record could be 30 or 40 millimeters of mercury. And here is a different way to look at the mitral stenosis murmur. And as the left ventricular pressure drops below that of the left atrium, we have the opening snap because of the calcified stenotic valve, and that is followed by a crescendo, decrescendo murmur, but the diastolic murmur begins right after the opening snap during the early rapid filling phase of the cardiac cycle, as I showed you in the first diagram. Then we have a sort of a continuous murmur here, which is accentuated by the atrial contraction during the presystolic phase, and hence it is called presystolic accentuation. Here is a different way to look at the murmur of mitral stenosis, which begins with the opening snap and is followed by a decrescendo murmur and a presystolic accentuation. Whereas in patients with the tricuspid stenosis, the murmur may increase in intensity from increasing the venous return to the right side of the heart during inspiration or squatting. The mitral murmur in a mild mitral stenosis have an opening snap which is happening a little bit later during the cardiac cycle, and it is followed by the crescendo, decrescendo murmur and a presystolic accentuation. Whereas in patients with severe mitral stenosis, because the valve is so significantly narrowed, the pressure difference begins right during the early rapid filling period. As a result, the opening snap may be happening very close to the second heart sound, and we also have a presystolic accentuation. And here is a tricky question which you may get in your board exams. They may say severe mitral stenosis with atrial fibrillation, what happens to the presystolic accentuation? The presystolic accentuation is created by the atrial contraction, and since you have a patient with atrial fibrillation, the presystolic accentuation is absent in patients with mitral stenosis. So that could be a board exam question. Let's talk about aortic regurgitation. Because the aortic valve is leaking, because the aortic valve is incompetent, when the left ventricular pressure drops below that of the aortic pressure, then we have a pressure difference, and because the valve is leaking, the blood regurgitates back into the left ventricle. Since patients with severe aortic regurgitation have high elevated end diastolic pressure, the equalization of pressures happens very quickly. As a result, we have a short decrescendo diastolic murmur. However, in most cases with mild degree of aortic regurgitation, where the diastolic pressure doesn't approach that of the aortic diastolic pressure, we can see a sort of a continuous low volume diastolic decrescendo murmur from aortic regurgitation. So the early decrescendo murmur is mostly seen in patients with severe aortic stenosis, where there is equalization of pressure between the aorta and the left ventricle, so there is no more blood flow during the later part of the diastolic period of the cycle. So that's an important point to keep in mind. As far as the area where we listen to hear the murmur best, for the aortic regurgitation, the best location would be the second right intercostal space, where we ask the patient to sit, lean forwards, and listen to the murmur during end expiration, where you can hear that diastolic rumble. Whereas mitostenosis murmurs are best heard at the apex while the patient is lying on the left side, and you use the bell, the short ring of the stethoscope, to hear, because it is a very soft, low frequency murmur. Third and final situation where we can hear a diastolic murmur, it would be again pan-diastolic in patients with patent ductus arteriosus. Because it's a to and fro murmur during cardiac cycle, we are going to hear a continuous murmur, especially at the apex or on the upper left sternal border. So ladies and gentlemen, this is a very quick review of diastolic murmurs and some of their misconceptions, and also the locations where you focus when you are listening to a murmur arising from an aortic valve or from a mitral stenosis patient. We have more than 200 lectures. We kindly request you to subscribe to our YouTube channel, and if you would like to get a copy of my cardiology rotations manual, you can send me an email to drniknikam@gmail.com. This cardiology seminar has been brought to you by Triple N Media, and please do subscribe to our YouTube channel, and I will see you in the next video.